Here at the Academic Health Science Network, we're absolutely delighted to be supporting the Patient Safety Collaborative on its work. The HSN's role is a regional one in supporting innovation and its adoption across health and social care. We're a membership organisation, and by virtue of that we have all the trusts, the CCGs and the universities in our region as part of the AHSN. And that allows us to bring expertise and support cross-organisational working across the region. And the Patient Safety Collaborative is probably our best example of where that's happening in practice. The Patient Safety Collaborative here in the North East and North Cumbria is up and running. It's very well led, and by virtue of the fact that it's embedded within the Academic Health Science Network, it's stronger for that. It's already delivering some serious impact.
Our PSC was set up about 18 months ago, and we took the decision to involve our whole region by starting 7 programmes for safety work in all our hospital trusts and involving all our commissioners. And our aim in, for example, work on pressure ulcers, acute kidney injury, fractures in hospital, is to improve the safety of patients throughout our region so that commissioners and trusts can deliver better health care.
From the National Priorities, a study commissioned from the North East Quality Observatory System, we identified 7 local priorities and established projects to further investigate these issues. Aiming to reduce avoidable pressure ulcers by at least 50% in 1 year, this project has over 100 participants from 10 NHS Foundation Trusts, CCGs, care homes and universities from the North East and North Cumbria. It's been successfully delivered through learning sessions, WebEx meetings and site visits. The North East Quality Observatory Service and Clarity Informatics collaborated with 8 NHS Foundation Trusts to develop a centralised repository to monitor the prevalence and implementation of recognised care bundles for sepsis and community-acquired pneumonia. The Resilience Project aims to improve health outcomes for children and young people by reducing mortality, unscheduled hospital admissions and A&E attendance that result from asthma or sepsis in childhood. The project is delivered through a regional collaborative of healthcare professionals that includes clinical and nursing staff from all acute hospital trusts across the North East and North Cumbria, patient transport and ambulance services and general practitioners. Currently, the project has multiple initiatives underway designed to contribute to the implementation of comprehensive, inclusive care pathways for both asthma and sepsis. This project seeks to streamline the way clinicians across the region identify and manage patients with acute kidney injury. Educational materials, pathways and a care bundle have been developed, and the training will be rolled out on the 9 NHS acute trusts in the North East and North Cumbria. This collaborative project builds on the work of the North East Regional Falls Task Group and aims to reduce inpatient falls. A fall-safe care bundle is being implemented on 14 wards across 2 NHS Foundation Trusts. The Think Safe project developed a number of freely available resources, including a personal healthcare logbook, a patient safety video, and a dedicated website to support the sharing of information between patients, their families and healthcare staff during a stay in hospital. It's been successfully implemented within 5 NHS Foundation Trusts across the North East. Think Safe officially launched at an event in February 2016 and has received national attention. Currently, the Think Safe team are examining mechanisms for rolling it out across the country. The structured review of events leading up to death provide a unique insight into the care delivered at each site and allow for learning across the multidisciplinary team. The North East Quality Observatory Service and the Clarity Informatics engaged with 3 Foundation Trusts to build a tool to deliver case note reviews of patient deaths. Alongside the projects, we hosted a series of events to celebrate and disseminate the achievements of all those involved. The high quality of the work being showcased ensured large audiences and high-profile speakers.
the Patient Safety Collaborative and Health Education England in the North East came together to create an executive to drive quality improvement and safety in the NHS, using 5 of the region's acknowledged experts, 4 of whom are members of Q. The aim is to help frontline staff improve the quality and safety of healthcare and to create a regional infrastructure that's capable of driving quality improvement across the NHS.
Embedded within the Academic Health Science Network in the North East and North Cumbria, the Patient Safety Collaborative is up and running and is already having an impact.
It's wonderful to see the work that the North East and North Cumbria Patient Safety Collaborative is leading. It's leading on so many fronts. It's also wonderful to see how organisations are coming together on a number of fronts and sharing information and learning together, because it's the learning platform that is so key to help all our clinicians, our doctors and nurses, to have better conversations with our patients to improve our outcomes for their care. The North East has had a long history of quality improvement in different elements, and so it's fantastic to see the energy and the commitment to lead the rest of the country in the work that you're doing.